Introduction to Public Health. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. It focuses on entire populations rather than individual patients, aiming to improve health outcomes on a broad scale. This field encompasses a wide array of activities, from controlling infectious diseases to promoting healthy lifestyles and ensuring access to care. Understanding its scope is crucial for addressing societal health challenges effectively. Public health professionals work to identify health problems, develop interventions, and evaluate their impact. Their efforts contribute significantly to the well-being and longevity of communities worldwide. Unlike clinical medicine, which treats individuals after they become sick, public health strives to prevent illness and injury from occurring in the first place. It involves analyzing health trends, identifying risk factors, and implementing programs to protect and improve community health. This proactive approach saves lives and reduces healthcare costs by fostering healthier living environments. Public health initiatives often involve policy changes, educational campaigns, and community-based interventions. The ultimate goal is to create conditions where everyone has the opportunity to live a healthy life, regardless of their socioeconomic status or geographic location. Core functions of public health. The core functions of public health are typically categorized into three main areas: assessment, policy development, and assurance. Assessment involves systematically collecting, analyzing, and making available information on healthy communities. This includes monitoring health status, identifying health problems, and diagnosing and investigating health hazards. Accurate data collection is fundamental to understanding the health landscape of a population. Without robust assessment, effective interventions cannot be designed. Public health agencies utilize various tools and methods to gather this crucial information, ensuring a comprehensive understanding of community needs. This continuous process helps to track progress and identify emerging health threats. Policy development refers to the efforts to inform, educate, and empower people about health issues, mobilize community partnerships, and develop policies and plans that support individual and community health efforts. This function translates assessment findings into actionable strategies. It involves advocating for public health, building consensus, and creating policies that promote health and prevent disease. Effective policy development requires collaboration among various stakeholders, including government agencies, community organizations, and the public. Assurance ensures that necessary health services are available to all, including enforcing laws and regulations, linking people to needed personal health services, and evaluating the effectiveness of health services. It guarantees that public health goals are met and services are accessible and of high quality. Key disciplines in public health. Public health is an interdisciplinary field, drawing expertise from various scientific and social disciplines to address complex health issues. Epidemiology is central, focusing on the patterns, causes, and effects of health and disease conditions in defined populations. Biostatistics applies statistical reasoning and methods to public health problems, aiding in data interpretation and research design. Environmental health examines the impact of the environment on human health, including air, water, and food quality. These disciplines provide the foundational knowledge for understanding and tackling public health challenges. Each plays a critical role in developing evidence-based interventions and policies. Their integrated application allows for a holistic approach to health improvement. Social and behavioral sciences investigate the human factors influencing health, such as culture, socioeconomic status, and individual behaviors. Health policy and management focuses on the organization, financing, and delivery of health services, as well as the formulation of public health laws. Global health addresses health issues that transcend national borders, requiring international cooperation and understanding. These diverse disciplines collectively contribute to a comprehensive public health framework. By integrating these areas, public health professionals can develop multifaceted strategies to promote health and prevent disease across various populations. the synergy between these fields is essential for effective public health practice. History of public health. The history of public health is a fascinating journey, marked by significant milestones and evolving understandings of health and disease. Early civilizations implemented basic sanitation practices, like managing waste and ensuring clean water, recognizing their importance for community well-being. Ancient Romans, for instance, built extensive aqueducts and sewage systems, demonstrating an advanced grasp of public hygiene. The Middle Ages saw devastating plagues, which, despite their tragic impact, spurred early quarantine measures and a rudimentary understanding of contagion. These early efforts laid groundwork for future public health interventions. The development of cities brought new challenges, necessitating more organized approaches to health. The 19th century was a pivotal period, with the Industrial Revolution leading to overcrowded cities and widespread disease. This era saw the emergence of modern public health, driven by figures like John Snow, who famously traced a cholera outbreak to a contaminated water pump. Louis Pasteur and Robert Koch's germ theory revolutionized understanding of disease transmission, leading to advancements in sanitation, vaccination, and hygiene. The establishment of public health agencies and the implementation of public health laws marked a new era of organized efforts. These historical developments underscore the continuous evolution of public health in response to changing societal needs and scientific discoveries, shaping the robust field we know today. Epidemiology basic concepts. Epidemiology is the cornerstone of public health, serving as the fundamental science for understanding disease patterns and determinants in populations. It involves the study of the distribution and determinants of health-related states or events in specified populations, and the application of this study to the control of health problems. Key concepts include incidence, which measures the rate at which new cases of a disease occur in a population over a specified period, and prevalence, which quantifies the proportion of individuals in a population who have a disease at a specific point in time or over a period. These measures are crucial for assessing the burden of disease and identifying populations at risk. Understanding these basic concepts allows public health professionals to track disease trends and plan interventions effectively. It provides the evidence base for public health action. Another fundamental concept is the epidemiological triad, which describes the interaction between the agent, host, and environment in causing disease. The agent is the causative factor, such as a bacterium or virus. The host is the organism harboring the disease, influenced by factors like immunity and genetics. The environment includes external factors that influence exposure and susceptibility, such as climate or socioeconomic conditions. Understanding this interplay is vital for identifying points of intervention to prevent disease transmission. Additionally, epidemiologists use concepts like risk factors, which are characteristics or exposures that increase the likelihood of developing a disease, and protective factors, which decrease this likelihood. These concepts guide investigations into disease outbreaks and inform public health strategies. Measures of disease frequency. Measures of disease frequency are essential tools in epidemiology for quantifying the occurrence of health-related events in populations. Incidence rate quantifies the number of new cases of a disease that develop in a population at risk over a specified period, often expressed per unit of person time. This measure is crucial for understanding the speed at which a disease is spreading or emerging. Cumulative incidence, also known as incidence proportion, represents the proportion of a population that develops new cases of a disease during a specified time interval. It is particularly useful for measuring risk in a closed population. These metrics help public health professionals track outbreaks and evaluate the effectiveness of prevention programs. They provide critical insights into disease dynamics and population health. Prevalence, on the other hand, measures the total number of existing cases of a disease in a population at a specific point in time, point prevalence, or over a period, period prevalence. Unlike incidence, prevalence includes both new and existing cases. providing a snapshot of the overall burden of disease. It is influenced by both the incidence and duration of a disease. For example, a disease with high incidence but short duration might have low prevalence. Understanding the distinction incidence incidence and prevalence is vital for interpreting epidemiological data correctly. These measures inform resource allocation, healthcare planning, and public health policy decisions, enabling targeted interventions to improve community health outcomes effectively. Epidemiological study designs. Epidemiological study designs are structured approaches used to investigate health outcomes and their determinants in populations. Observational studies, such as cohort studies, case control studies, and cross-sectional studies, observe subjects without intervention. Cohort studies follow a group of individuals over time to see who develops a disease, often used to determine incidence and risk factors. Case control studies compare individuals with a disease, cases, to those without, controls, to identify past exposures. Cross-sectional studies examine a population at a single point in time, providing a snapshot of prevalence. These designs are crucial for identifying associations and generating hypotheses about disease causation. Each design has specific strengths and limitations regarding causality and generalizability. Experimental studies, primarily randomized controlled trials, RCTs, involve an intervention and are considered the gold standard for establishing causality. In an RCT, participants are randomly assigned to either an intervention group or a control group, minimizing bias and allowing for direct comparison of outcomes. This design is commonly used to evaluate the effectiveness of new treatments, vaccines, or public health interventions. While powerful, RCTs can be costly, time-consuming, and sometimes ethically challenging. Understanding the appropriate application of each study design is fundamental for conducting rigorous public health research and drawing valid conclusions about health interventions and disease etiology. The choice of design depends on the research question, available resources, and ethical considerations. Biostatistics in public health. Biostatistics is the application of statistical methods to biological and health-related problems, forming an indispensable component of public health research and practice. It provides the tools to design studies, analyze data, and interpret results, enabling evidence-based decision-making. Key statistical concepts include descriptive statistics, which summarize and describe the main features of a dataset, such as means, medians, and standard deviations. Inferential statistics, on the other hand, allows researchers to draw conclusions and make predictions about a larger population based on a sample. This distinction is crucial for understanding the scope and generalizability of research findings. Biostatistics ensures the validity and reliability of public health data. Common biostatistical methods used in public health include hypothesis testing, confidence intervals, regression analysis, and survival analysis. Hypothesis testing helps determine if observed differences or associations are statistically significant or likely due to chance. Regression analysis explores relationships between variables, such as the association between exposure and disease outcome. Survival analysis is used to study the time until an event occurs, often applied in chronic disease research. Proficiency in biostatistics allows public health professionals to critically evaluate scientific literature, design effective interventions, and communicate health risks and benefits accurately. It transforms raw data into meaningful insights that drive public health action and policy. Environmental health principles. Environmental health is a critical public health discipline focused on understanding and mitigating the impact of environmental factors on human health. It encompasses the assessment and control of physical, chemical, and biological factors in the environment that can potentially affect health. Key principles include prevention, which emphasizes proactive measures to avoid environmental hazards rather than reacting to their consequences. The precautionary principle suggests that if an action or policy has a suspected risk of causing harm to the public or to the environment, in the absence of scientific consensus that the action or policy is harmful, the burden of proof that it is not harmful falls on those taking the action. This proactive stance is fundamental to protecting public well-being. Understanding these principles helps guide policy and intervention strategies. Another core principle is environmental justice, which advocates for the fair treatment and meaningful involvement of all people regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. This principle recognizes that environmental burdens often disproportionately affect marginalized communities. Risk assessment and management are also crucial, involving identifying potential hazards, evaluating their risks, and implementing strategies to reduce exposure. These principles collectively guide efforts to create healthier and safer living and working environments. By applying these principles, public health professionals work to protect communities from a wide range of environmental threats, ensuring a sustainable and healthy future for all. Water and sanitation. Access to safe drinking water and adequate sanitation facilities is a fundamental determinant of public health. Contaminated water sources are major pathways for waterborne diseases such as cholera, typhoid, and dysentery, which disproportionately affect vulnerable populations. Public health interventions in this area focus on ensuring water quality through treatment, distribution, and monitoring systems. This includes processes like filtration, chlorination, and regular testing to remove pathogens and harmful chemicals. Providing safe water reduces the incidence of diarrheal diseases, a leading cause of mortality, especially among young children. Effective water management is critical for preventing widespread illness and promoting community well-being. It is a cornerstone of global health efforts. Sanitation refers to the provision of facilities and services for the safe disposal of human urine and feces, as well as the maintenance of hygienic conditions through services such as garbage collection and wastewater treatment. Poor sanitation contributes to the spread of infectious diseases, environmental pollution, and dignity issues. Public health initiatives promote improved latrines, wastewater treatment plants, and hygiene education, particularly hand washing. These measures break the chain of infection and prevent the contamination of food and water sources. Integrated approaches that combine safe water, sanitation, and hygiene wash interventions are proven to have significant positive impacts on public health outcomes, reducing disease burden and improving quality of life, especially in developing regions. Air quality and health. Air quality is a significant environmental health concern, as exposure to pollutants can have profound impacts on human health. Air pollution, both outdoor and indoor, contributes to a wide range of respiratory and cardiovascular diseases, including asthma, bronchitis, heart attacks, and strokes. Common outdoor pollutants include particulate matter, ozone, nitrogen dioxide, and sulfur dioxide, often originating from industrial emissions, vehicle exhaust, and burning fossil fuels. Indoor air pollutants can come from sources like tobacco smoke, cooking fuels, and building materials. Public health efforts focus on monitoring air quality, identifying major sources of pollution, and implementing regulations to reduce emissions. These interventions aim to protect vulnerable populations, such as children and the elderly, from adverse health effects. Improving air quality is a critical step towards enhancing overall public health. The health effects of air pollution are not limited to respiratory and cardiovascular systems. Long-term exposure can also impact neurological development and increase the risk of certain cancers. Public health strategies to improve air quality involve a multifaceted approach, including promoting cleaner energy sources, encouraging public transportation, and implementing stricter industrial emission standards. For indoor air quality, interventions include promoting proper ventilation, discouraging smoking indoors, and using cleaner cooking technologies. Education and awareness campaigns also play a vital role in informing the public about the risks of air pollution and encouraging protective behaviors. By addressing air quality comprehensively, public health professionals strive to create healthier living and working environments, reducing the global burden of disease associated with polluted air. Food safety and nutrition. Food safety and nutrition are indispensable components of public health, directly impacting individual and community well-being. Food safety encompasses practices and conditions in the production, handling, storage, and preparation of food to prevent contamination and foodborne illnesses. Contaminated food can lead to a range of health issues, from mild gastrointestinal distress to severe, life-threatening conditions. Public health efforts include regulating food production, inspecting food establishments, and educating the public on safe food handling practices. These measures are crucial for preventing outbreaks of foodborne diseases and ensuring a safe food supply. Effective food safety systems protect consumers and support public trust in the food industry. They are vital for economic stability and public health. Nutrition focuses on the intake of food in relation to the body's dietary needs, playing a critical role in preventing chronic diseases and promoting optimal health. Malnutrition, including both undernutrition and overnutrition, poses significant public health challenges. Undernutrition can lead to stunted growth, weakened immune systems, and cognitive impairment, particularly in children. Overnutrition, often linked to diets high in processed foods, contributes to obesity, diabetes, and cardiovascular diseases. Public health interventions promote balanced diets, encourage consumption of fruits and vegetables, and address food insecurity. Nutrition education, food labeling regulations, and community-based programs are key strategies. By ensuring both food safety and adequate nutrition, public health aims to foster healthier populations and reduce the burden of diet-related diseases globally. Health policy and management. Health policy and management is a crucial public health discipline that focuses on the development, implementation, and evaluation of policies and programs designed to improve population health. It involves understanding the political, economic, and social contexts that shape health systems and influence health outcomes. Key areas include health legislation, regulatory frameworks, and resource allocation. Effective health policies can address issues such as access to care, disease prevention, and health equity. Public health managers are responsible for planning, organizing, and directing health services and programs. They ensure efficient operation and alignment with public health goals. This discipline bridges scientific evidence with practical application, translating research findings into actionable strategies. It is essential for building robust and responsive health systems. The management aspect involves strategic planning, financial oversight, human resource management, and quality improvement within public health organizations. Public health leaders must navigate complex administrative structures, engage diverse stakeholders, and communicate effectively to achieve their objectives. They are tasked with optimizing resources to deliver impactful health interventions and services. Policy analysis is another critical skill, involving the systematic evaluation of proposed and existing policies to determine their potential effects on public health. This includes assessing feasibility, cost-effectiveness, and ethical implications. By combining strong policy development with effective management, public health professionals can create sustainable solutions that enhance the health and well-being of communities on a broad scale. Health economics fundamentals. Health economics applies economic theories and principles to the field of health and healthcare, providing a framework for understanding how scarce resources are allocated to improve health outcomes. It examines the production, distribution, and consumption of health and healthcare services. Key concepts include efficiency, which refers to maximizing health benefits from available resources, and equity, which concerns the fair distribution of health and healthcare. Understanding these concepts helps policymakers make informed decisions about healthcare spending and resource allocation. Health economists analyze the costs and benefits of different health interventions, guiding investments in public health programs. This field is crucial for optimizing the impact of limited budgets on population health. Cost-effectiveness analysis, CEA, and cost-benefit analysis, CBA, are fundamental tools in health economics. CEA compares the costs of different interventions with their health outcomes, often expressed in terms of quality-adjusted life years, QALYs, or disability-adjusted life years, DALYs. CBA goes a step further by assigning monetary values to both costs and benefits, allowing for a direct comparison. These analyses help determine which interventions provide the greatest value for money. Public health decision-makers use these economic evaluations to prioritize programs, allocate funds, and advocate for policies that yield the most significant health improvements for the population. Health economics ensures that public health initiatives are not only effective, but also economically sustainable and justifiable. Health communication strategies. Health communication is the study and practice of informing, influencing, and motivating individual, institutional, and public audiences about important health issues. Effective communication is vital for promoting healthy behaviors, preventing disease, and ensuring public understanding of health risks and benefits. Strategies include developing clear and concise messages, utilizing appropriate channels, example, social media, traditional media, community outreach, and tailoring content to specific target audiences. Public health campaigns often aim to raise awareness about vaccinations, healthy eating, or the dangers of smoking. The goal is to empower individuals to make informed decisions that positively impact their health. Successful health communication can significantly influence public perception and behavior. Key principles of effective health communication involve clarity, credibility, consistency, and cultural appropriateness. Messages must be easy to understand, come from trusted sources, and be consistent across various platforms. Cultural sensitivity ensures that messages resonate with diverse populations and avoid unintended negative interpretations. Public health professionals employ various communication models, such as the health belief model or social cognitive theory, to design interventions that address specific behavioral determinants. Evaluation of communication campaigns is also critical to assess their reach, impact, and effectiveness. By mastering health communication, public health practitioners can bridge the gap between scientific knowledge and public action, fostering healthier communities through informed engagement and behavioral change. Social and behavioral health. Social and behavioral health explores the complex interplay between social, cultural, psychological, and behavioral factors and their impact on individual and community health outcomes. This discipline recognizes that health is not merely the absence of disease, but is profoundly shaped by social determinants such as socioeconomic status, education, housing, and access to resources. Behavioral factors, including diet, exercise, smoking, and substance use, also play a critical role in disease prevention and health promotion. Public health interventions in this area aim to understand these determinants and develop strategies to foster positive health behaviors and create supportive social environments. Addressing these underlying factors is essential for achieving health equity. It requires a holistic view of human well-being. Key theories and models from social and behavioral sciences, such as the health belief model, social cognitive theory, and the trans-theoretical model, are applied to design effective health promotion programs. These models help explain why people adopt or reject health behaviors and guide interventions to facilitate change. Community-based participatory research, CBPR, is often employed, involving community members in all stages of the research process to ensure interventions are culturally appropriate and sustainable. Public health professionals work to reduce health disparities by addressing social inequities and empowering communities to take control of their health. By integrating social and behavioral insights, public health can develop more effective and equitable strategies to improve population health and well-being. Health equity and disparities. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments and healthcare. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. These disparities are often linked to social, economic, or environmental disadvantage. Public health aims to identify and address the root causes of these inequities. Achieving health equity is a core ethical and practical goal of public health. It ensures that all individuals have the chance to thrive. Addressing health disparities requires a multi-sectoral approach that goes beyond healthcare. It involves policy changes in areas such as education, housing, employment, and environmental protection. Public health interventions focus on advocating for policies that promote social justice, investing in community-based programs that support vulnerable populations, and ensuring equitable access to quality health services. This includes culturally competent care and services that are tailored to the specific needs of diverse communities. By systematically identifying and dismantling the structural barriers that perpetuate health inequities, public health professionals strive to create a society where health is not determined by one's social position. The ultimate goal is to eliminate preventable differences in health outcomes and ensure optimal health for all. Global health challenges. Global health addresses health issues that transcend national borders and are influenced by worldwide political, economic, and environmental factors. It emphasizes transnational health problems, determinants, and solutions, often involving international cooperation. Major global health challenges include infectious diseases like HIV/AIDS, tuberculosis, and malaria, which continue to devastate populations, particularly in low-income countries. Non-communicable diseases, NCDs, such as cardiovascular disease, cancer, diabetes, and chronic respiratory diseases, are also rising globally, posing a significant burden. These NCDs are often linked to lifestyle factors and aging populations. Addressing these challenges requires coordinated international efforts and resource sharing. Global health recognizes the interconnectedness of health worldwide. Other critical global health challenges include maternal and child mortality, malnutrition, mental health disorders, and the health impacts of climate change and humanitarian crises. Access to essential medicines, vaccines, and healthcare services remains unevenly distributed, exacerbating health inequities. Public health initiatives at the global level involve strengthening health systems, promoting universal health coverage, developing new vaccines and treatments, and advocating for policies that address the social determinants of health on a global scale. Organizations like the World Health Organization, WHO, play a crucial role in coordinating these efforts. Understanding global health is vital for developing effective, sustainable solutions that improve health outcomes for all people, regardless of their nationality or economic status. Infectious disease control. Infectious disease control is a fundamental pillar of public health, aimed at preventing and managing the spread of communicable diseases within populations. This involves a range of strategies, including surveillance, which is the ongoing systematic collection, analysis, interpretation, and dissemination of health data. Early detection of outbreaks is critical for rapid response and containment. Vaccination programs are another cornerstone, providing immunity to individuals and contributing to herd immunity within communities. Public health campaigns promote vaccine uptake, ensuring broad protection against preventable diseases. Isolation and quarantine measures are also employed to separate infected individuals or those exposed to pathogens, thereby limiting further transmission. These interventions are crucial for protecting public health from microbial threats. They require constant vigilance and adaptation. Effective infectious disease control also relies on robust public health infrastructure, including laboratories for rapid diagnosis, trained personnel for contact tracing, and clear communication channels for public alerts. Antimicrobial stewardship programs are vital to combat antibiotic resistance, a growing global health threat. Environmental controls, such as safe water and sanitation, play a significant role in preventing the spread of many infectious agents. Furthermore, health education on hygiene practices like hand washing empowers individuals to reduce their risk of infection. By combining these multifaceted approaches, public health professionals work tirelessly to minimize the impact of infectious diseases, protect vulnerable populations, and respond effectively to emerging pathogens, safeguarding community health and well-being. Non-communicable disease prevention. Non-communicable diseases, NCDs, also known as chronic diseases, are a leading cause of mortality and morbidity worldwide. These include cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases. Unlike infectious diseases, NCDs are not transmitted from person to person, but result from a combination of genetic, physiological, environmental, and behavioral factors. Public health prevention strategies focus on modifying key risk factors, such as unhealthy diets, physical inactivity, tobacco use, and harmful alcohol consumption. These lifestyle choices are often influenced by social and economic determinants of health. Comprehensive public health programs aim to reduce exposure to these risk factors across entire populations. Early detection and management are also crucial for improving outcomes. Preventing NCDs is vital for sustainable health systems. Effective NCD prevention requires a multi-sectoral approach involving governments, healthcare providers, communities, and individuals. Policy interventions include implementing taxes on unhealthy products, regulating marketing as harmful substances, and creating environments that support healthy choices. Example: safe spaces for physical activity, access to nutritious food. Health education campaigns raise awareness about risk factors and promote healthy lifestyles. Screening programs facilitate early diagnosis and intervention for conditions like hypertension or certain cancers. Public health professionals advocate for integrated care models that address both NCD prevention and management. By tackling the root causes and risk factors of NCDs, public health aims to reduce premature deaths and improve the quality of life for millions globally, fostering healthier and more productive societies. Maternal and child health. Maternal and child health, MCH, is a public health priority focused on the health of women, infants, children, adolescents, and families. This field aims to improve health outcomes for mothers and children, recognizing their unique vulnerabilities and the profound impact of early life experiences on long-term health. Key areas of focus include prenatal care, safe childbirth practices, postnatal care for mothers and newborns, and childhood immunizations. Reducing maternal and infant mortality rates is a central goal, often achieved through improved access to quality healthcare services and skilled birth attendants. Public health programs provide education on nutrition, breastfeeding, and family planning. These interventions are crucial for ensuring healthy starts to life and promoting the well-being of future generations. Addressing MCH challenges also involves tackling broader social determinants of health, such as poverty, education, and access to clean water and sanitation. Public health initiatives advocate for policies that support pregnant women and new mothers, including paid parental leave and affordable childcare. Early childhood development programs promote cognitive and social growth, recognizing the critical window of opportunity in a child's first few years. Adolescent health is another important component, focusing on issues like sexual and reproductive health, mental health, and substance abuse prevention. By investing in MCH, public health not only saves lives, but also fosters healthier families and communities, contributing to sustainable development and a more equitable society. It is a cornerstone of a healthy population. Occupational health and safety. Occupational health and safety, OHS, is a public health discipline dedicated to protecting the health, safety, and welfare of people engaged in work or employment. It aims to prevent work-related injuries, illnesses, and fatalities by identifying, assessing, and controlling hazards in the workplace. This includes physical hazards like noise and extreme temperatures, chemical hazards from toxic substances, biological hazards from pathogens, and ergonomic hazards from repetitive motions or poor workstation design. Public health professionals in OHS develop and enforce regulations, conduct workplace inspections, and provide education to both employers and employees. Ensuring a safe working environment is not only a legal requirement, but also a fundamental human right. It contributes significantly to overall public health. Key OHS interventions include implementing engineering controls to eliminate or reduce hazards at the source, such as ventilation systems or machine guarding. Administrative controls involve changing work procedures, like rotating tasks or limiting exposure times. Personal protective equipment, PPE, such as hard hats, gloves, and respirators, provides a barrier between the worker and the hazard. Public health also focuses on promoting worker well-being through programs addressing mental health, stress management, and healthy lifestyle choices. Surveillance systems track work-related injuries and illnesses to identify trends and inform prevention strategies. By fostering safe and healthy workplaces, OHS professionals contribute to a productive workforce and reduce the burden on healthcare systems, ultimately enhancing the health and longevity of the working population. Emergency preparedness. Emergency preparedness and response is a critical public health function focused on anticipating, planning for, and reacting to public health emergencies, disasters, and catastrophic events. These events can include natural disasters like hurricanes and earthquakes, infectious disease outbreaks, bioterrorism attacks, and chemical spills. The goal is to minimize morbidity and mortality, protect public health, and ensure a rapid and effective recovery. Key components include developing comprehensive emergency plans, establishing communication protocols, and training public health personnel and first responders. Public health agencies collaborate with other government entities, healthcare systems, and community organizations to create a coordinated response. This proactive planning is essential for mitigating the impact of unforeseen crises. It saves lives and reduces suffering. Effective emergency preparedness involves several phases: mitigation, preparedness, response, and recovery. Mitigation efforts aim to reduce the likelihood or severity of an emergency, such as building codes for earthquake-prone areas. Preparedness focuses on developing plans, stockpiling resources, and conducting drills. The response phase involves immediate actions taken during an emergency, including surveillance, medical countermeasures distribution, and public communication. Recovery efforts concentrate on restoring public health and infrastructure after the event. Public health professionals play vital roles in all phases, from risk assessment and epidemiological investigation to mass vaccination campaigns and mental health support. Continuous evaluation and updating of emergency plans are necessary to adapt to new threats and improve response capabilities, ensuring communities are resilient in the face of adversity. Public health ethics. Public health ethics is a specialized field that examines ethical issues and dilemmas arising in public health practice, research, and policy. It provides a framework for making morally sound decisions that balance individual liberties with the collective good of the community. Key ethical principles often considered include beneficence, doing good; non-maleficence, doing no harm; justice, fairness in resource distribution; and respect for autonomy, respecting individual choices. Public health interventions, such as mandatory vaccinations, quarantine, or fluoridation of water, often raise complex ethical questions. Balancing the protection of the population with individual rights and freedoms is a constant challenge. Ethical considerations guide the development of policies that are both effective and morally justifiable. Public health ethics also addresses issues of equity and social justice, recognizing that health disparities are often rooted in systemic injustices. It calls for prioritizing the health of vulnerable and marginalized populations. Transparency and public engagement are crucial for building trust and ensuring that public health decisions are made openly and accountably. Ethical frameworks help public health professionals navigate situations where there are competing values or interests, such as during a pandemic when individual freedoms might be restricted for the greater good. By adhering to ethical principles, public health aims to ensure that its actions are not only scientifically sound, but also morally defensible, fostering public trust and promoting a just and healthy society for all its members. It is a continuous process of reflection and deliberation. Community Health Assessment. A Community Health Assessment, CHA, also known as a Community Health Needs Assessment, CHNA, is a systematic process of collecting, analyzing, and reporting on the health status, needs, and assets of a community. The purpose of a CHA is to identify key health issues and resources within a defined population, providing data to guide public health planning and resource allocation. This process involves gathering both quantitative data, mortality rates, disease prevalence, and qualitative data, e.g. community perceptions, interviews with residents. It helps public health professionals understand the unique health challenges and strengths of a particular community. A thorough assessment is the foundation for effective public health interventions. It ensures that programs are relevant and impactful. Key steps in conducting a CHA include defining the community, collecting data from various sources, e.g., vital statistics, surveys, focus groups, analyzing the data to identify health priorities, and disseminating the findings to stakeholders. Community engagement is a critical component, ensuring that the assessment reflects the perspectives and needs of the residents themselves. This participatory approach fosters ownership and increases the likelihood of successful interventions. The results of a CHA inform the development of Community Health Improvement Plans, CHIPs, which outline strategies and actions to address identified health priorities. Regular assessments allow communities to track progress, adapt to changing needs, and continuously improve their health outcomes. It is a cyclical process that drives continuous public health improvement. Future of public health. The future of public health is characterized by evolving challenges and innovative opportunities, driven by technological advancements, shifting demographics, and emerging global threats. Digital health technologies, including artificial intelligence, big data analytics, and wearable devices, are poised to revolutionize surveillance, diagnosis, and intervention delivery. These tools will enable more precise and personalized public health approaches. Climate change presents an escalating threat, impacting health through extreme weather events, altered disease patterns, and food insecurity, demanding integrated environmental and health strategies. Addressing health equity will remain a central imperative, requiring systemic changes to dismantle structural barriers to health. Public health must adapt to these complex dynamics. It requires foresight and adaptability. Global interconnectedness means that future public health will increasingly focus on international collaboration to address pandemics, antimicrobial resistance, and humanitarian crises. The integration of public health with other sectors, such as urban planning, education, and social services, will become even more critical for creating healthy societies. A greater emphasis on mental health and well-being, alongside physical health, is also expected to shape future interventions. Public health professionals will need to continuously develop new skills in data science, communication, and interdisciplinary collaboration. By embracing innovation, fostering equity, and strengthening global partnerships, public health can continue to safeguard and improve the health of populations worldwide, navigating the complexities of the 21st century with resilience and foresight.